Whether you have dentures that you hate or you lose a single tooth, either way, you need a replacement and you need it quickly, right? Well, mini dental implants are a great option to get your smile back to looking great. Dr. Richard Boatman from Troy Family Dental is here this morning to explain the benefits of mini dental implants. Welcome back, Doctor. Always nice
Great
to have
be
you
back.
here.
Thanks.
Let's start on a level playing field. Let's
Yep.
assume that nobody knows anything about this. What is a mini dental implant?
A mini dental implant is, just as the name implies, it's a much smaller implant. And because it's much smaller, it has some great benefits. One of the great benefits is it's very minimally invasive. So it takes really minutes to place these things. Patients are typically sore only one day that we control with some pain medication.
Wow.
And the healing time is about 1/2 also. Another great benefit is because they're a lot smaller, less chair time, less cost of the implant, much less cost to the patient, 1/3 to 1/2 the cost of traditional implants.
Less time in the chair means less time that you're laboring, which means a smaller bill at the end of the day. So I'm trying to think of a downside. I don't really hear one. It's quicker, it's cheaper, and the recovery time is that you're not going to be sucking down milkshakes for a week.
Exactly.
Which is great.
Yeah.
And then the next question would be, well, I have a very unique case. I just need a bridge, I just need uppers, I just need a single tooth. Is it that kind of versatility that the mini dental
It really is. One of the more common things that we use it for are patients with bottom dentures. That can be crippling. There's just not much to hold that denture in place.
Right.
So it just kind of floats in place. I've never met a patient in 30 years that liked denture glue.
Yeah.
So we can place 4 mini dental implants in less than 15 minutes. And then 2 months later, when they're healed, we can take their denture, place snaps in it, and then you can snap that denture in place, and now it's in place. Now they can bite much better, and they don't use that denture glue any longer. And it preserves the bone. The bone will continue to shrink every single year. And I've seen patients that had like this much bone left in their mandible.
Wow.
It could be bad.
That's a big deal.
It is.
Good. Preserving as much of that bone as you possibly can. And then moving down the line, again, options for different circumstances. And the complaint I'm sure you've heard a million times from denture wearers is that false palate on the top.
It is. You can't taste your food as well. A lot of patients have a severe gag reflex, have a very difficult time with it. So we need 6 instead of 4. It's a little bit bigger arch. But once those are healed, we can actually take their denture and remove that palate. Now they taste their food much better, and now they don't have to deal with that gag reflex. And then we just snap that into place, and now they can bite much, much better. And
is that something that they're putting in and removing, or do you snap it into place and cement it in there?
No, actually the patient can, these are pretty tight snaps, but the patient can remove these so that they can keep these implants clean. Very, very important to keep the implants clean.
Yeah, hygiene, the hygienic aspect of this is a big deal.
Absolutely.
And maybe you just need to replace a bridge, or you've got 1 or 2 missing teeth, you can still do that.
You can do 1 or 2 missing teeth or a single tooth.
That. Wow.
In this case here, this is 3 teeth. We place 4 little mini implants. 2 months later, when they're healed, we take this little bridge, we cement it right in place, and now it's like they have their natural teeth again.
So let me ask a dumb question. In that interim period between the placement of the posts and then the permanent appliance, what's there in the meantime?
Sometimes if the implant is very stable, you can place a temporary, especially if it's in the aesthetic zone. A lot of times, actually, just the top of the implant sticks out the top of the tissue.
Because it's hidden back there and nobody can even see it?
Yeah, it gives the tongue something to do. They get bored back there.
They get bored. They need friends.
They do.
Thank you so much, Doctor, for coming in. This is great. Mini dental implants. They get bored back there. To make an appointment with Dr. Boatman or Dr. Spencer at Troy Family Dental, you can call the number right there on your screen, because they get bored too, frankly. 618-477-8421. You can also find them on the web. That's troyfamilydental.com.